Good afternoon. On behalf of, let me take this off for a second. On behalf of What Now and the Progressive Social Network, both of Lebanon County, I wanted to welcome you to today's town hall. What Now and PSN are two local progressive action groups. You can read about us more on the agenda you have. I do encourage you to get to talk to some of the members who are here today and reach out with them and see what options we have and opportunities we have available for you to help work with us as we go forward. My name is Natalie Duvall. I'm the president of PSN. Some of our members are here as well today. Unfortunately, the leader of What Now, which is based out of Mount Gretna, is not here today. She was hoping to make it on time, but last night at around 8 p.m. she learned the flight that was taking her here was canceled, so she can't be with us today. I would like to thank, we have representatives from several local action groups here with us today, so I want to thank those groups for coming, especially the Concerned Citizens Action Group. They're out of Westchester, and they helped us with the format, and also they helped us deliver many invitations to Representative Costello. I'd also especially like to thank the Allen Theater. They are providing the space for us today free of charge, so if you wanted to give them a nice hand. Lebanon County, as you know, is in a very unique and unfortunate situation. We're split almost evenly into two congressional districts, and each of those districts includes towns and cities that are much larger and unfortunately much more affluent than we are. This is unfortunate for us because of that they have many different issues than we do. District 6 includes Berks, Chester, and Montgomery counties, including suburbs of Philadelphia. District 15 includes all of Lehigh County, parts of Northampton and Dauphin, including Hershey. Okay. The hope of today's town hall was for Representative Charlie Dent of Allentown and Ryan Costello of Westchester to come to our county and have a discussion with us about issues that are pressing and pertinent to members of our community. Invitations were personally sent to both offices, but as you can see, we're still not having either of them in attendance. Representative Dent is most likely out of country right now in official government business, and Representative Costello unfortunately stated on the Laura LeBeau show that he thinks our town hall is an attack or a setup. For those of you who are here, you see that that's not the case. So we'll continue to engage in dialogue for the next hour, and we will record portions of this to send to the congressmen so they can see what our concerns were. So let me first explain the format of what's happening today. We're going to start with a guest expert. He'll talk about issues concerning healthcare and also a bit about our state budget. That will be followed with a time for questions for him. On stage behind me, you see two empty chairs. These chairs represent our absent congressmen. You'll see up with me is a microphone. So after our guest presentation, Laura Quick, who's over there waiting, will be manning this microphone for us. I'll begin by announcing topics in order. When you signed in, you talked about topics that were important to you. So when the time for each topic is brought up, come line up in front of Laura and she will guide you with the microphone. Okay? If you don't want to be videotaped, because we do have video recordings and Facebook live streaming going on, Laura has a sign she will hold up and let our reporters know to stop taping. There she has it there, so she will hold that up for you. After we've exhausted the biggest issues, we will take some time for general issues. If you have something to say but don't want to say it yourself, please use one of the cards to write down your questions, and Laura will read it for you. Okay? We do have a short period of time today because there's a movie that's going to kick us out soon. So we'll limit each question and topic. Please don't take offense. We just want to make sure everyone who's here has a chance to speak if they would like it. We do reserve the right to remove anyone if you're being disrespectful or disruptive. I don't think that'll be the case, but we do just want to remind you that if you do choose to actually address our wonderful congressman up on stage, that you do so with the demeanor you would if they were actually here. further ado, let me begin by introducing you to Dr. Marc Stier, the director of the PA Budget and Policy Center. He has a long history in politics, political organizing, and grassroots movements. Before becoming director of the Pennsylvania Budget and Policy Center, Marc served as the executive director of Penn Action, where he worked to protect funding for women's health and education and expand Social Security. And he does want to talk a little bit about that today as well. He was the director of Pennsylvania Healthcare for America Now, which led the grassroots efforts in support of what did become the Affordable Care Act in Pennsylvania. He was also the healthcare campaign manager for SEIU Pennsylvania State Council. Marc was an academic for 25 years, and he received his doctorate in political science from Harvard University. He's taught at the University of Alaska Fairbanks, City College of New York, UNC Charlotte, and Temple, where he was the associate director and internet coordinator of the Intellectual Heritage Program. He's the author of numerous papers on political philosophy, the history of political thought, and American politics. You can see the list of his most recent publications in your agenda for the day. So without further ado, please welcome Dr. Marc Stier.
Thanks, everyone. Good afternoon.
Hello.
Thank you all for coming, and thank you, Natalie, for inviting me. I'm really happy to be here in this absolutely gorgeous theater. Sometimes I've spoken around the state in a lot of old theaters, but I have to say this really is the most spectacular one I've seen. Can you hear me? Oh, is that better?
Yeah. Where's the mic? Right in the mouth.
I'll just hold it up right here, okay?
It's for sale, or you want to buy it?
What, the theater's for sale? You know, my father actually, when the commercial theater in my hometown in upstate New York went out of business, my father and a bunch of friends bought it, and they converted it. So, and I was an usher for a little while, one of my earlier careers. But I think I'm gonna leave that in the past. I'm really happy here to come talk a little bit about healthcare. As Natalie mentioned, I was the state director of the Healthcare for America Now campaign, and I know some of you were part of our mailing list and were active in that campaign with us. We had a big event in Lebanon at one point with Senator Specter, where the Tea Party first showed up. And I think we showed them in 2009 that there were a lot more of us than of them in this state. And I think you're all showing them again if that's the case. At any rate, the ACA is very close to my heart. It's, I often joke that it's my second child. And like my first child, Katja, it's not perfect, but I don't want to repeal and replace it any more than I want to repeal and replace my daughter. So, but that's what they're about to do. They're going to try to do again. And I want to talk just very briefly about what we expect is going to come next week, what that bill is going to look like, and why it's so horrible. And then I'll take some of your questions. I'm not going to go into enormous detail. I'll wait and see what questions you have. And then, as I said, at the end, I can come back and talk a little bit about some state budget things, because there's some healthcare implications for that as well. So this is what we know about next week. First, I want to say something about why they won't give up this idea of passing legislation on healthcare. Part of the answer is they're embarrassed. After 7 years of talking about how terrible the ACA is, about repealing it, they're embarrassed they haven't been able to do anything. And so, with Trump's 100th day coming up, they want to pass something. Now, I don't think that's the whole reason, because if Trump really just wanted to do something, he could sit down and make a deal with the Democrats and some of the centrist Republicans and fix those parts of the ACA that are actually problematic. And he could say only he could do it, and that's actually true, because no Democrat could make a deal with Republicans, but Trump could make a deal with the Democrats if he really wanted to fix the ACA. And you know, I for one would be happy to call it Trump care from now on, if they did fix it and kept it and improved it. But that's not what they want to do. And the reason they don't want to do it is because fundamentally this is about cutting taxes for rich people and for corporations. That's really what's at issue. If you look at the healthcare plan, and I'll go into the details in a minute, it's not just a repeal of most of the ACA, it's also a major cut to Medicaid. Something which Paul Ryan says he's been dreaming about doing since he was a sophomore in college. Imagine that. You know, I wouldn't tell you what I was thinking about doing most of the time when I was a sophomore in college, but it wasn't cutting back Medicaid. It wasn't even increasing Medicaid. What they want to do is basically repeal the ACA taxes, which would save about $500 billion over 10 years. Half of it would go to the top 2% of households in the country. In Pennsylvania, it's almost like 90% of the tax cuts would go to the top 1%. And the other half would go to insurance companies and pharmaceutical companies and insurance company executives. One of the neat things about the ACA is we actually capped how much they could deduct for paying insurance company executives. After $1 million a year, they couldn't take a bigger tax break. They want to repeal that, which would cost about $40 million a year to the federal government. So they want to get rid of those taxes that are part of the ACA. But that's not the whole thing. Because the reduction in the federal deficit from their healthcare legislation would go beyond repealing the ACA. It would go to this major cut in Medicaid, a cut of about $880 billion over 10 years, rather. And it would be a savings in the deficit of about $300 to $500 billion over 10 years. And the reason they need that savings is so that they can then pass a tax, so-called reform bill, which would cut corporate taxes and cut taxes on the wealthy even more. And it would do it without drastically increasing the deficit. And just to show you how complicated it is, the reason they need to have this pot of money to use for so-called tax reform later is because they want to pass it through the Senate reconciliation rules so they can avoid a filibuster. And the only way to do that is if they don't increase the deficit over 10 years. So they need a pot of money to use to cut taxes for corporations and for the wealthy. Not just in the ACA repeal, but in the tax reform package that's coming later. And the money they're going after is healthcare money. And that's really what this is fundamentally about. That is why they won't give it up. I'm sorry if that was kind of complicated, but the rules of Congress are kind of complicated, and this whole fiasco is oriented about figuring out how to pass major tax cuts for corporations and wealthy while working through the Senate rules that get around the filibuster. So that's the background of this. So what do they want to do? What's in this legislation? Like I said, we don't know all the details yet, but this is what we suspect. First of all the bad stuff in the last bill, it's here again. They are going to strangle the Medicaid expansion. It's going to take 3 or 4 years, but by the end of 4 years, half the people who got in health insurance with the Medicaid expansion will be off of it. By the end of 8 years, almost no one will be on Medicaid expansion, and it will gradually disappear. That's a huge number of people. In this state, it's about 700,000 people. With regard to the subsidies for health insurance and the exchanges, the plan is probably going to look a lot like the last plan. A flat amount of money, not adjusted for income, a slight adjustment for age, but what that's going to mean is that, again, as in the last plan, people who are older, who are in their 50s, 60s, before Medicare, will see a massive reduction in the subsidies that they've been getting for health insurance. And they're also going to widen the brackets so people who are at an older age will be asked by insurance companies to pay 5 times what people who are younger pay, not just 3 times under the ACA. So they'll see insurance premiums go up and the subsidies radically go down. We're thinking for someone in the age of 55 to 60 who has an income of about $40,000 a year, now people are getting a subsidy of about $11,000 to $13,000 a year. That's going to go down to $4,000 a year. And what that means is large numbers of people who've been getting health insurance through the healthcare exchanges, and that's about 320,000 people in Pennsylvania, will no longer be able to afford it. So about 200,000 people will lose, 200 to 300,000 people will lose insurance that way. All told, between what they're going to do the exchanges and the end of Medicaid expansion, we're estimating that 1.1 million people a year in Pennsylvania will lose health insurance. And that's actually more than the number of people who got health insurance through the ACA, because this is going to have an effect even in the private insurance market beyond the exchanges, for complicated reasons I'm not going to go into as well. So that's what was in the last bill. It's basically in this bill as well, as far as we know. There are two new things in this bill, or one big new thing. As you know, two of the most popular parts of the Affordable Care Act are, one, the prohibition against insurance companies denying people coverage if they have pre-existing conditions. That is an enormously important thing. I mean, the fact is, by the time you get to be my age, everyone has a pre-existing condition, right? I mean, life's a pre-existing condition. But, you know, there are a lot of younger people who have the misfortune of having some kind of illness that makes it very difficult for them to get insurance before this ban on the insurance companies denying them insurance went into effect. Now, they're not going to get rid of that directly. But what they're going to do is say, if a state seeks a waiver from the federal government to do away with that prohibition, the federal government can grant that waiver. And they're going to set it up in such a way that it's pretty much automatic. As long as the state says to the federal government, we think we can reduce insurance premiums if we say that we won't force insurance companies to insure everyone regardless of their medical condition, and that'll save people money. It'll be an automatic waiver. Now, that won't happen everywhere right away. It won't happen as long as we have a Democratic governor of Pennsylvania. But imagine the next governor of Pennsylvania is Republican, and that we have a Republican legislature, and they decide, like they wanted to do when they didn't want to take the Medicaid expansion, they decide, we're going to seek a waiver. Well, they could do that. The federal government would automatically approve it, and that would not just affect people who have insurance through the exchanges, it would affect your insurance no matter how you buy it. If you have a pre-existing condition, the insurance companies will then be able to deny you coverage. And then there's a second provision. You know, there's this provision called the essential benefits provision that says that every insurance policy has to cover a certain 10 basic conditions. Now, the Republicans like to make fun of this because they say, why should a woman pay for a health insurance policy that covers prostate care? And why should a man buy insurance that covers pregnancy? And you might think, well, that makes a certain amount of sense, except, you know, it all washes out at the end. If you require every policy to cover all the basic things for everyone, it's not changing what we pay very much. Because the fact is, there aren't very many women who are going to seek care for prostate problems, and there aren't many men who are going to seek care for pregnancy, and it all washes out at the end. It doesn't really raise costs. Here's why that essential benefits provision is important. You remember the bad old days before 2010. You might go to an insurance company with a pre-existing condition, and they would say, well, we'll cover you, but we're not going to cover you for that condition. Well, you can buy insurance, but you know, if you have colon cancer in the past, we'll cover everything except the recurrence of colon cancer. Right? Or, you know, if you've had a brain tumor and, you know, successfully operated on, we'll give you health insurance, and it'll be fairly reasonable cost, but it won't cover any recurrence of a brain tumor or metastasized tumor that we can say rightly or not comes from a brain tumor.